and YouTube live. All right, we're going live on YouTube. We are going to be live on Facebook here in a minute. Looks like I am. All right, let me get situated here. Oh. Give me a second. I'll adjust the camera, guys. Kind of a new setup I've got going on here. It's a little bit awkward there with the YouTube one, so give me a second. Let me see if I can switcheroo this. Hold on, guys. Hold on. Sorry, this is so awkward. New technology to me, and I don't have fancy devices, and that's not going to work. Okay, hold on one second, Facebook. I know you're there. Hold on one second, guys. I'll be right with you. Okay, YouTube, so hold on. I had it right. That second thing I did. Okay, we're going to get this figured out. I know I'm upside down. It'll flip in a second. At least I hope it did. It will. Flipped a second ago. Wow. So why did it flip before? I don't know. But it's going to flip again. Okay, so here we go. Last time I'm trying it, YouTube. If I'm upside down, I'm upside down. Alright. Give me 3 seconds here, Facebook. I'm getting my you-know-what together. Okay, guys. Sorry about that. Okay, if you're joining on YouTube, I apologize for not looking into this camera very often. But I have 2 different cameras, 2 live streams going here. So let me get situated here just for a second with my other stuff. And then we will get going. Lots of interesting news to share today. And let me start by introducing myself if you don't know who I am. While I get ready, excuse me for not making eye contact, but my name is Ginger. I'm also known as the Pain Warrior Princess. And I have chronic illnesses, chronic pain, and I also have decreased immunity, which unfortunately, for the past 2 weeks or so, it would seem that my decreased immunity has decreased even further, thanks to my allergies progressing into a sinus infection. So, by the way, thank you everybody who checked in on me, said, are you sure that's all it is? You know, do you have any of the symptoms of COVID-19? I've said it before, I'll say it again. No, I don't. And honestly, I'll say it as many times as you guys ask me, because I think it's so amazing that everyone is being so concerned and caring and empathetic and all of that right now. It's a wonderful thing. So, Kratom, absolutely. Diet. I have been using Kratom for over 10 years. And I don't get sick very often, thankfully, and that might have something to do with it. But I don't want anyone to run out and try Kratom. Don't do that. It's those of you who have been on my page for a while know that before I have discussed issues with the legality of Kratom and our government trying to change the legality, and it's even illegal in Alabama and some other places. But yes, I have used Kratom for over 10 years, Diet. Thank you so much for your comment. I have used it for chronic pain, and it's helped me quite a bit. I do recommend it to people, so thank you again for your comment. So, as you probably saw on the post that I put up about today's live video, there are certain topics that I'll be discussing, just like every night. If you're new here, every day I try to do it by 5 o'clock. Usually by 4, but I kind of give myself a little window there just in case. So, oh, hi from Indonesia. So, yeah, you are quite familiar with not only Kratom, but the Kratom tree. So, that's great. I will also apologize in the beginning because just like last night, I still have a fever. Yep, Bally too. I still have a fever from the sinus infection. I'm a little schwitzy. I hope you can't see it, but it's going to happen. I apologize. That's just the way it is right now. But for those of you who were concerned, I did start the antibiotics last night. So in 10 days, I should be golden. One thing I am a little bit concerned about, though, just to kind of vent for a second, the antibiotics I need to knock out the sinus infection, but antibiotics, as you probably know, also get rid of some of the good bacteria in the gut also. And most of our immune system lives in our guts. So I'm being very, very cautious right now, and I'm replenishing with probiotics. I'm having a lot of yogurt. I'm eating healthy, while I'm on these antibiotics. So just something to kind of keep in mind. Okay, guys, let's get started. As usual, I have my other device here with some notes. I don't know if you can see it. You probably can't. There's a tub of water over here that I'll pull into the screen when it's relevant. Also, my allergies have kicked up again, so if I dab my eyes or something like that, that's what it is. I'm so sorry. I know it's not attractive. I'm so sorry. I'm falling apart. But COVID-19 is very important. We all have to stay updated. And just for Diot, I haven't seen you here before, so just really quickly, I'd like to explain, due to being a patient in the medical system for over 25 years and having decreased immunity and all the conditions I have, I'm very familiar with all these terms that are being used. I don't know if you can see our presidents in the task force's press conferences in Indonesia, but basically they talk about a lot of different medical terms and things like anecdotal evidence and clinical trials, and they give a lot of information that for me I'm very used to, but I know for a lot of people they're not everyday terms. So I take this information and make it kind of relatable with examples from my own life as a patient and examples from everyday life. So let's get started. If you don't mind, I am going to get a quick drink here because I was kind of rushing to get on and I didn't do that beforehand, but we're going to do a little demonstration later. I have some visual aids, and tomorrow I'm going to show you how to make that. So we're kind of still giving the important information, but moving into some more useful kind of tips and things that are a little bit more light, but they're still relevant. So let me get a little quick drink and then we'll get going. All right, folks. So first on the agenda are the White House and New York State press conferences. Okay, so I did want to clarify something, because yesterday in his press conference, Governor Cuomo said, you know, FEMA is only sending me 400 ventilators and I need 30,000. What am I going to do with 400? I addressed that yesterday, but President Trump had tweeted that 4,000 ventilators were sent to New York State after I did my live. I don't know if he tweeted it this morning or late last night. I'm not sure which, but I did double check it, verify it, and also Governor Cuomo said today there were actually 4,000 ventilators sent to New York State. So if you heard the 400 yesterday or you saw the 4,000 today and or both, yes, it was 4,000 ventilators. As you all know, I'm all about accurate information. I'm all about sourcing my information. So you know when you're here that you will get all of that. So I think there was some good news out of New York State. No, I'm not wearing rose-colored glasses. No, my head is not buried in the sand. But in a situation like this, and I know this from my own life with my chronic pain, every time I go into my pain management doctor, they ask me, since the last time we've seen you, is your pain better, worse, or the same? Sometimes the pain being the same is a good thing because it's not worse. And that's kind of the situation with some of the stats from New York State today. So 80% of the cases are still self-resolved. So 80% of the people who have COVID-19 can self-resolve. They don't need to be hospitalized, which means, of course, they don't need the ICU, which is after you go in the hospital, if you get much sicker, then you're in the ICU and need a ventilator. So 80% are still resolved. 15% of the positives need hospitalization. Now, those are higher than the projections and the estimates that they had made before. But it's still great news that 80% of the cases are self-resolved. You know, there's one of the things that's so difficult about this, and I have talked about it before, is that it's so new that everything is a projection or an estimate. And when you're doing something like that, especially when it comes to making sure that your population can be cared for in you know, for the medical industry, whether that's PPE or that's ventilators or that's hospital beds or that's human resources, staff, it's very difficult to do that but the projections, the way that they have to do them is almost a worst case scenario because they want to be prepared for the worst. Like I've always said, every time I rode my motorcycle and it was cloudy, if I put on my rain suit, it didn't rain. So I prepared for the worst, but I was okay for any other scenario under that happened. So if it sprinkled a little bit, if the sun came out, I was good. I know it's not quite the same, but that's kind of an example from my real life about preparing for the worst. So they need to do that. And like I've been saying, you know, what we have now are projections and estimates. They're getting more and more data in every day, but it is going to take some time to really kind of be more sure of what's going to happen. All right, so I'm trying to debate if I want to say this. I think I do, though. I just didn't write down when the other numbers were from. And I don't want to give you numbers without data, and I apologize. I must have missed that from before. Let me just read through it 10 seconds. Let me just see if I have another note there that makes sense. Okay, yes, I understand what I wrote. I'm sorry. So 140,000 of the patients in New York State with COVID-19 go into the hospitals. They need hospitalization. And there are 40,000 ICU cases, so they need a ventilator, okay? Now, the problem in New York is they have 53,000 hospital beds, which obviously there's a big difference between 53,000 and 140,000. So what they need is higher than their capacity. And they have 3,000 ICU beds. Now, what this means, what information you can take from this is do everything you can, especially if you have chronic conditions, you're immune compromised, or you are a young and healthy person. Even young and healthy people can get very sick with this. They usually recover, but they can get very sick. So remember, even if you are asymptomatic, you have to be very careful around the groups I just mentioned, plus older people, those going through chemo, things like that. Now, I don't mean to scare you with those numbers in terms of the need or the estimates that I mentioned before versus the capacity, because there are other arrangements being made. So I'm sure you guys have heard by now of the, I believe it's a Red Cross ship that's coming into New York Harbor. I think it's the Mercy. And there's also some kind of like field hospitals being built. They're using the Javits Center. If you're not, you haven't been to New York City, the Jacob Javits Center is a huge conference center. If you're from Phoenix, or convention center, I should say. If you're from Phoenix, think Phoenix Convention Center, that kind of big. And I think it might even be bigger. I haven't been to the Javits in a while, but it's pretty big. So, what that also means in terms of the need or the estimates versus the capacity is that we really need to get the curve of this. You know, they talk about flattening the curve. We really need to get that curve flattened as soon as we can. What does that mean? Wash your hands, sanitize your surfaces. No large groups. Stay in if your state has told you to. Self-isolate. All of those things will help us get to that point sooner. There also was a mandate to the hospitals that I don't think I mentioned yesterday, that Governor Cuomo is requiring them to somehow make 50% more beds available. Now, no, they can't just build a wing out of thin air or go like that and there's beds. But for these types of more critical patients, what they can do in the hospital is they can move some beds maybe from, I don't know, obstetrics, so from the labor and delivery ward into these areas. That's just an example. I don't know if they're going to do that, but that's an example. He has asked the hospitals to try for 100% more capacity, but what he has mandated is 50%. So again, I just want to go back. I know the numbers are kind of scary when it comes to capacity versus need or estimates, but there are things that are being done to handle that. But the most important thing to try to do is try not to get COVID-19, try not to expose anybody else to it by not following the precautions that we're supposed to do. The New York City plan that I had mentioned was submitted and approved. Remember, not last night, but the live before that, I had said that Governor Cuomo had asked Mayor de Blasio 24 hours ago for a plan. He hadn't gotten it yet. He did get it by noon yesterday, and it has been submitted and approved. So what they're going to do in New York City is close some of the streets to cars so people can walk down them. If you haven't been to New York City, the sidewalks are not really that huge, especially in certain neighborhoods. So by opening the streets to pedestrian traffic, it allows people to get outside, maybe get a little exercise, get some fresh air, and not be on top of each other. If you've ever been to Times Square, you can kind of think of that in your head. Not that every street in New York, every sidewalk in every neighborhood in New York is like Times Square, but that will give you the idea of density that they're trying to kind of eliminate that problem as best they can. Also, in playgrounds, they're very worried about social density. Now, this is more for my New York City family and friends, but it's good information for other people to know too, just to be educated. They've asked, no basketball games because you can't be 6 feet apart and playing basketball. Not if you want to win. Doesn't really work that way. Or they will close down the playgrounds. So it's very, very important. Now it's voluntary that, social distancing, please don't play basketball. But if it's not followed, they will close the parks or the playgrounds. So that won't be good. There is some more good news. Between Sunday, Monday, and Tuesday, there were some good changes in the number of people in New York State needing hospitalization that are COVID-19 positive, okay? On Sunday, the numbers needing hospitalization were doubling every 2 days. By Monday, it went down to doubling every 3.4 days. And by Tuesday, it went down to doubling every 4.7 days. So that means that obviously the amount of people needing to be in the hospital is not necessarily going down, but is being more spread out. I don't have the numbers of people going into the hospital each day, so I'm not going to come out and say that that's for sure, but it shows that reducing the density and self-isolating and all of that stuff is working. I know if you're like me, sometimes you want to do something and see a result. And with something like this, that's not really how it works. Part of it is because of the incubation period of this virus. It's very long. It can be between like 1 and 14 days. The average is 5, but 14 days is the number to go with, because you don't know. You can't ask the virus, hey, how long are you hanging out for? Like, you can't do that. So be safe. 14 days. The social distancing works. The reducing the density works. And he also kind of said, I like that Governor Cuomo has been a little bit of a therapist as of late, because New York State is going through some shit right now. Like, let's not sugarcoat it. But it is effective and necessary, even if it's a burden. So you guys all know from last night what I talked about, from watching the news. The New York City metro area is being hit very hard. And if you weren't here, or Diet, I don't know how familiar you are with the New York City area, but I'll do my little air map again. So New York City is here, let's say. Long Island is here. New Jersey is here. Pennsylvania is here. Connecticut is here. So there, in Massachusetts is right there too. So there are a lot of different areas kind of in the same one. And the issue with that is every state has a different governor. And then there are county lines. And then there are all these things like this. So the New York metro area is kind of being hit very hard. And I'm hoping that the governors and all that are working together to kind of solve that. So I'm sure you'll all be happy to know that yesterday's delivery of PPE in New York State stocked all the New York State hospitals with supply for now. So that means our healthcare professionals are protected now. Just being real and honest with you, like I always am, in 3 to 5 weeks, that might not be the case. In 2 weeks, it might not be the case. But we can help protect those healthcare workers and practitioners by doing what we're supposed to be doing. It all comes back to that. I've said it many times. I'll probably say it 3 or 4 more times tonight while I'm on. We can't stop the virus. We can't. It's here. There's no way to stop it. The only thing we can do now is contain it. If we can contain it, then we'll have enough time where the incubation period for everybody has passed, self-isolating period has passed, quarantine has passed, all of that stuff, and then we can move on from this. Ventilators. Okay. So I know people were worried about ventilators. Like I said, they had 4,000, well, like I said, FEMA sent 4,000. They had 4,000 already, and they bought 7,000. So 15,000 ventilators. Last night I also talked about they're trying to put 2 patients on 1 ventilator. So again, the ventilator brings oxygen into your lungs and pulls carbon dioxide out. And it's obviously 2 different tubes that do that. So what they're trying to do is hook it up so they can have the 2 sets of tubes come out of 1 machine and care for 2 patients at once. So obviously that would be 15,000 ventilators times 2 would be 30,000 patients. So that would be an awesome thing if they can do that. Okay, splitting reminder. Oh, splitting reminder. I wanted to remind myself to tell you guys what I just told you so we can go past that note. There's something in New York State pretty incredible that's happening, I think. I have, like I said, family in New York, all over New York State, actually, and in the metro area. And I have friends in New York, and 40,000 people who are medically trained and have basically answered the call for volunteering. So Governor Cuomo came out and said, please, if you have any medical training, if you're a medical professional, we need people. Please volunteer. And 40,000 people did. That's pretty incredible. Not only that, 6,175 mental health professionals have volunteered also. So New York State is stepping up. I got to tell you guys, I'm very proud of you. I think it's awesome. You know, we can't kind of forget the fact that this is a scary situation, and our mental and emotional health is important, just like our physical health. So that's awesome that they've stepped forward. There is a hotline that you can call if you would like to speak to one of the volunteers in the mental health hotline. I'll give it to you now, so kind of get a pen and paper, or get ready to kind of text yourself a note or whatever. While I tell you, I'm also going to be putting this in that resource list that I talked about last night. I'm still working on it. There's a lot I'm trying to gather and make sure that it's all labeled correctly. So if you're looking for very specific information, I send you right there. I don't want to send you somewhere else where you have to hunt for it. Okay, that number for New York State for the mental health professional volunteers that are talking to people about COVID-19 and what we're all going through is 1-844-863-9314. I'll give that number again in a minute, but I just want to say, if you are a mental health professional and you would like to volunteer, there's actually a website that you go to and you submit a form. I will be putting that in the resource list also. But for now, that number again, if you would like to speak with one of the mental health volunteers in New York State, helping people through this whole COVID-19 thing, it's 1-844-863-9314. So there you go. And again, like I said, the resource list, it's coming, guys. It's coming. It's just, I've been pretty busy and I want to make sure, again, I get you accurate information. I should just tattoo that on my forehead. Accurate information from me. Might take time. Okay. Let's see what else. Okay, I told you about where to go if you wanted to volunteer and where. Okay, very cool. All right. They are estimating it's going to be about 3 weeks before New York State reaches the peak of the bell curve, or the apex. They keep calling it the apex, but think of it as the top of the bell curve. So that's when things will start to sorry, my arm went way too high. Things will start to flatten out, and then they'll start to come down. How long will they stay flat? I don't know. But the apex is the top of it, and then things will start to flatten out, and then we'll see less infections, and that will be hopefully very soon. But they're estimating in New York State it'll be 3 weeks. Okay. All right, so statistics. 28% of the COVID-19 tests done in the U.S. have been done in New York State. As you know, that is the worst hit state in our country. As of this morning, because the press conference was this morning, and actually let me kind of backtrack on that a little bit. The press conference airs at 8 a.m. my time, which is 11 a.m. New York time. But for sure, they didn't just type in these slides 5 seconds before they came out for the press conference. And we know these numbers are constantly changing, constantly, unfortunately, going up right now. And these percentages will change too. But in the slides they had in the press conference, there have been 30,811 positive tests. Okay, 3,805 are currently hospitalized. That's 12% of the positives. And of the ones that are hospitalized, 888 are in the ICU. That is only 3% of the total number of positives, though. So let's keep that in mind. So what does that mean? 97% of the positives are not in the ICU. That also means 88% of the positives are not in the hospital. So let's keep that in mind too, okay? Let's get out some more positive information here with the big numbers, okay? All right. There is a cluster in Westchester. It's the worst one in the U.S., but it's dramatically slowed the increase. So what they think happened, and I talked about it last night, I'm going to go through it real quick. They think that before Sunday at 8 o'clock, when New York City after that, it was only essential people, only essential workers going out. They think a lot of people left New York City and went either to Long Island or like Westchester or somewhere else. And what they're worried about is that these people are carrying COVID-19 and they're asymptomatic, or the symptoms are so mild they're not seeking any medical attention, and they're probably spreading the virus if they have COVID-19 and they're out. So what they've said is, if you've left New York City, wherever you've gone to, self-quarantine for 14 days total. So like if somebody left New York City 3 days ago, they need to self-quarantine for 11 more days. They think that some people are kind of resistant to that. And in fact, there was the New York Health Commissioner that came out and said that he wouldn't follow that. Why don't I talk about that right now since we're on the topic? I was very disappointed with that, by the way. I understand that he's a very qualified individual. He's the health commissioner, but he went against the advice of Dr. Birx, who was on the federal task force, the White House task force. And I looked up the reason why, because I wanted to understand. Let me pull up that source for you. Okay. So this is from the link that I happened to grab is from marketwatch.com. However, I did see it on other news sources. So his name is Dr. Howard Zucker. He's New York State's health commissioner, and this is what he had to say. He said, quote, "I would not follow that," end quote. And he advised instead following the CDC guidelines, which recommend avoiding proximity to others, washing hands, and disinfecting surfaces often, and for people who feel sick to stay home. He went on to say, quote, "I would follow the guidelines in general that you should social distance. These cases are all over the country. It's not just New York. We're at the forefront, as the governor has said, but it's elsewhere." Okay, so why is this stupid? Because it is elsewhere, and we don't want it to get worse elsewhere. So it really doesn't make sense to me that this man said that. It really doesn't. Especially when these people are coming from the epicenter of the pandemic, in the U.S. part of the pandemic of COVID-19. They're coming from the epicenter and going elsewhere, even though there are already people who are infected in that elsewhere. Maybe not. We don't know whose house they're going to and if they're positive or not. Why wouldn't you just be extra careful and cautious and self-quarantine for 14 days? I think this is horrible advice. I'm not a doctor. I just have common sense, which I'm finding out a lot the past few weeks is not always that common. But anyway, pardon me, I'm going to switch positions here. My hips are a little bit crampy. I apologize for that. Fibromyalgia, you know. Okay, so I'm probably going to butcher his last name. I apologize. Dr. Bill Hanage, Hanage. I am so sorry if I got that wrong. He's actually an associate professor of epidemiology at Harvard's T.H. Chan School of Public Health. And he says, he actually agreed. Sorry, he actually agreed. The next doctor disagreed. But so this genius said, but the disease, quote, but the disease has been present and spreading across communities in every state, not only New York. If it were only in New York, it would make sense. The issue is it isn't only in New York. Therefore, the opportunity to shut the disease out entirely with such measures is already gone. No one has talked about shutting the disease out entirely. Ever. No one has ever said that. So why he piped up and said the opportunity to shut out the disease entirely? What? What are you talking about? No one has said that. So another genius with his opinion. I'm frisky tonight too. Boy, I thought it was just the other night. I'm frisky. He also questioned the reason for telling travelers from New York City to self-isolate for 2 weeks and not people coming from other local hotspots in Washington State and California. Quote, I don't understand the singling out of New York, a place that is doing the best testing. Well, because it's the epicenter. That's why. And the chance that somebody has it in a city with a density of New York City is probably greater than that of somewhere else. Maybe not Los Angeles, I'm not sure. But in New York City, the difference between LA and New York City is that New York City, most people walk everywhere or they take public transit. They don't drive their car down the 101 freeway in LA for 3 hours trying to get 20 minutes from their house. That's the difference. I cannot believe that these people are doctors and trained and they lack so much common sense. Is it me? Am I stupid? Or are these things like fairly obvious? Sometimes I think people just say things to get a quote out there. I don't know. That just really makes me mad because he's not on the task force. Neither one of them are. I'm sure the New York State's health commissioner is somehow involved, though I don't remember seeing him at a press conference of Governor Cuomo's. I could be wrong, but I don't remember seeing him. All right, let's get to somebody who made sense about this, okay? Part of the problem, too, with these people from New York City going elsewhere is a lot of those places are kind of vacation communities. So I'm sure you've heard of the Hamptons, or you've heard of like P. Diddy's party, the black and white party, or the white party, whichever it was he had, in the Hamptons. It's like really exclusive, really expensive homes. So a lot of these people are more seasonal. And they're probably going to be uncomfortable if they're there in their homes and all these people are coming from the city, and who knows if they're positive or not. They were just trying to get out before they had to stay in. Let's see. The other problem with that too is a lot of those communities have very limited emergency medical facilities and capacities and very few ICU beds. So that's another reason why it makes sense for these people who fled New York City to self-quarantine for 14 days. It just bothers me when there's no common sense and there are people who are spouting opinions that are just stupid. They're just stupid. Sorry. I'm telling you, I'm frisky. I don't know if it's the fever or the antibiotics or what, but I am frisky. Okay, so let's hear from somebody who actually has a brain in her head. Dr. Cheryl Hilton, Dean of the NYU, New York University's School of Public Health. Quote, they are only scaled for full-time residents. Let me end the quote right there for a sec. She was talking about the medical facilities and in ICU capacity. Quote, that would be a problem in the event of an outbreak, which would quickly overwhelm the local health system. If traveling to those remote areas, it might make sense for anyone coming from a hard-hit area, including New York, to exercise increased caution, which may include a period of self-isolation. quote, "I don't think it's a bad idea for anyone coming from a hotspot if they're entering a community with a lower baseline. I don't think that's unreasonable." So, there you have it. It's not unreasonable. If you fled New York City before Sunday at 8 p.m., please self-quarantine yourself for 14... Wait, that was redundant. Please self-quarantine for 14 days. Please do that, okay? For all the reasons that I mentioned, and because it's common sense. If you were supposed to self-quarantine in New York City, why wouldn't you self-quarantine anywhere else? That's what I don't get. Because you don't want to, maybe, but that's not a good enough reason. Okay, is this still live? Because I can't tell. Yes, okay. I'm sorry, I'm still getting used to the new live interface on Facebook, and it's kind of, it looks different, so I'm just double checking that everything's still going. All right, we talked about the lovely New York Health Commissioner and his brilliant opinion. Let's move on. Okay. And they did say in New York State, any hospital can get someone tested. They are strategically testing for COVID-19 in the most dense areas, though. And again, that makes sense. I know a lot of people are concerned and kind of up in arms that there's not testing all over the place. Well, like we talked about last night, and like they keep saying in the press conferences, New York State and the White House one, the resources right now need to go where they're needed the most. They will be going to other places soon, but we have to get the situation in the epicenter under control before we can do anything else. The statistics were very sobering this morning from the New York State Press Conference. I did not have time to grab the ones from tonight. Like I said, I'm going to make kind of a chart with those because rattling off these numbers, they sound high, they are high. Let's just say this, the cases keep going up, and it continues to be incredibly important for us to do what we're being asked to do and to take care of ourselves. So, let's move on. We need to talk about the White House press conference, so let me grab my notes for that. There's not a whole lot from today's that's like new information. As I said before, I'm not going to talk too much about the coronavirus relief bill or whatever it is that they're going to call it, that everybody's fighting about in the Senate, and I'm not going to talk about it right now, just because I don't want to put information out there and somebody count on it and then it changes before it passes. So I don't want to do that. Let's see. You know what? There is something I want to mention tomorrow night because I didn't have a chance to look it up tonight. So let me just mark that so I don't forget. We are using the Defense Production Act where it's needed. Again, remember, a lot of companies have volunteered, stepped up, retooled to make masks and other stuff. So let me just make sure all the comments I saw and I responded to. Okay, I did. So that's great. Where the Defense Production Act is needed, we are using it. And I mean where in terms of both mostly products right now, but it's not limited to that. Could be like a location where if there's 5 factories in New York City that can make or can retool or can figure out how to make some PPE, they might use it there. The Defense Production Act does not mean nationwide this is what's going on, okay? So where needed is both products, I guess what's needed, products and area. Let's see. So we are on day 10 of 15 days to stop the spread. I hope you guys are hanging in there. I know for those of you who are not used to kind of self-isolating all the time anyway, I know it can be a little like, ugh, so bored of this. But if you're bored, reach out. I have a great YouTube channel that I watch with comedy videos. He's a really funny dude. He's kind of silly and awkward and does a lot of puns and some physical comedy. So I can send you that if you'd like. Pence also said something that I've been saying for a while, and it was something that I told you before, the task force really can't say. Well, now they're kind of leaning toward that a little bit. So remember when I said, you know, if we don't do what we're supposed to do for 15 days, that 15 days is going to be a lot longer. So Vice President Pence today said, quote, "We can hasten the day." So that means we can bring about the day where we start to get back to our normal lives if we do right now what we're supposed to help stop the spread of the coronavirus strain that's in our country and all over the world right now. So Dr. Birx had a good reminder for us. It's still important to monitor and look out for the flu. The flu is still a possibility, so we have to look out for that. And of course, there are different symptoms between the flu and COVID-19. So like they've been saying from before, there are certain symptoms that kind of set them apart. There's the matrix that I put. It's both on my Instagram at Pain Warrior Princess. It's on my personal Facebook feed. If you can't find it, because there's a lot of stuff on my Facebook feed, let me know. I'll be happy to send it to you. But yeah, just kind of, you can take a look at that. And it's great because it compares COVID-19 to influenza and allergies. And I believe that latest one I posted also has the common cold on it. So you can kind of see the difference between them. And then if you have symptoms, you can look it up and kind of see where you fall. Sorry. They are still, there's something called the flu surveillance platform that they're monitoring flu-like illnesses. Why? Again, because some symptoms, they're not all the same symptoms, but some symptoms are similar. So like body aches. If you have the flu, you very often have body aches. If you might have COVID-19, you could have body aches. If you have fibromyalgia, you always have body aches. But anyway, tangent. But yeah, so they are monitoring that too. It's important to track those things as well. And what they're doing too is looking for changes in those patterns. So that's something that I'm sure they'll talk about later, but they did want to bring it up because it is something else that they're working on to kind of help keep us healthy at this time. So like we talked about, New York metro area is being hit really, really hard. So that's New York City, Westchester County, Suffolk County, and Nassau County. Suffolk and Nassau are pretty much Long Island. Sorry. Oh, I hope I don't get hiccups now. Sorry. So 56% of all cases in the U.S. are in the New York metro area. 60% of new cases are in the New York metro area. So in the entire U.S., the New York metro area has 56% of all COVID-19 cases. Of all the new cases, 60% is in the New York metro area. That is another reason why, if you have fled New York City, you need to self-isolate for 14 days. Monitor yourself carefully. Don't, go around people who are vulnerable, just to be safe. Dr. Birx told an interesting thing about her grandmother, I believe she said. And the bottom line is this, and I'll tell you the details after that. The bottom line is you don't want to be the one to bring this virus home. You really don't. Because if somebody gets sick from it, you will have to live with that for the rest of your life. If they get sick with it and they have very mild symptoms and in 3 weeks they're fine, that's wonderful. I mean wonderful that they recovered, not wonderful they got it. But if you bring this home and someone gets very, very sick with it, and there are cases, I'm going to talk about some in a few minutes. I'm going to put them on the resource list. I won't go into all the details, but young, healthy people are getting this. So don't just think that if you bring it home and stay away from your grandma, you're okay. If you bring it home, anybody in your household could get it. They are still working on trying to figure out if you've gotten it once, if you can get it again. There was some information the other day, and they think as long as certain parts of the genetics of the virus do not mutate, as long as the, what did she call it exactly? I want to use the right terms. Y'all know me. It was in the virtual town hall. Okay. Oh, she just said certain parts stay constant. So I was correct in what I said. Certain parts stay constant, then if you've had the virus once, then you shouldn't get it again, this strain. So, but her grandmother, Dr. Birx's grandmother, when she was a kid, brought home the flu, and someone in her family died because of it. I think it was her mother. So her grandmother's mother died from that, and Dr. Birx's grandmother had to live with that every day, knowing that for all her life. That's not something that you want on your conscience. Okay. And that, by the way, that was the flu pandemic of 1918. That example from Dr. Birx. There's still going to be sharp increases in the numbers of cases due to 1 to 2 weeks ago, these people were infected, but because of the long incubation period, it's not, they're not testing positive until now. And there's also a lab backlog. Remember, we talked about that. They are getting caught up. We talked about the numbers yesterday of tests that have been run, so they are getting caught up. In 8 days, the U.S. ran the same number of tests as South Korea did in 8 weeks. So we are getting that stuff under control. We are getting it all caught up. Okay. So, a lot of people want to make something between Dr. Fauci and President Trump. And I talked about it before. If you weren't around, basically these men are coming at this from different perspectives. So it was about the chloroquine, that thing that I can't remember how to say right now, which is ridiculous because I know it. So Trump kind of had I think I'm hopeful it looks good. And Dr. Fauci is, give me the scientific data. Give me the clinical trials. Give me results for X amount of people that I can feel comfortable that it's going to work. So Dr. Fauci comes at things from a scientific scientist, prove it to me first point of view. Doesn't mean he doesn't believe that the treatment will not work. It means that is his perspective. So he actually stated today in the press conference that he's a scientist. He's not a politician. Guys, he doesn't want to be a politician. If he wanted to be a politician, he would have done that. But right now, it is his job to go out and do some of that press conference stuff. And I don't think it's his favorite thing to do. Honestly, it wouldn't be my favorite thing to do. But it's not because who he's next to at the podium. It's not because he hates the press. It's not because he doesn't agree with what's being said. It's because he wants to get back to work. He wants to be a scientist and a doctor and figure this out and help people and cure them. And that's his jam. That's what he wants to do. So people are trying to make something out of nothing. I think I said it several days ago, but I'm going to say it again. Reporters are used to getting the scoop. What that means, if you're not familiar, maybe you guys don't have that phrase there. It basically means you're the first one with a story. You're the first one to publish the story or say the story on a newscast or something like that. And nobody is getting a scoop right now. None of these reporters, because the White House task force is the one delivering the news in the case of that press conference, right? So not only is one reporter not getting the scoop, but neither are any of their competitors. So they're all trying to find a story somewhere. They're all trying to find something somewhere because the news coming out about COVID-19 is the facts. This is what it is. And then they put spin on it, or they try to make it sound like the doctor and the president don't agree, or they try to make it sound like this chloroquine is dangerous because some idiot bought aquarium cleaner because it was chloroquine phosphate and not chloroquine, and that's the president's fault because he touted this as that's what's going on. Let me see what else Dr. Fauci said. I am going to have to get going kind of in a few minutes here, guys, and we'll have to finish the rest of the stuff tomorrow, but I just want to make sure, these are kind of things that they talked about when it happens, when people go back to work, when we open the borders again, when we let flights come in from, other continents and stuff. We're going to have to be kind of very careful and watch it. So cases are not imported to the U.S. Cases of COVID-19 are not imported to the U.S. And we end up going through this again with at least some of the population. So that's the first important thing moving forward, is that we don't import any more cases and we curve the inflections from other countries' outbreaks. So what that means is we want it flattened out or to go down. That doesn't mean that we've won. That doesn't mean it's over with. It means that things are getting better. Things are going in the right direction, he said specifically. People asked if it was seasonal. It might be, but in the southern hemisphere, they're actually going into winter now, and they're still seeing cases of COVID-19. So they're not sure. The treatments are important, but the vaccine work that they're doing is even more important. So let me see here what else I wanted to talk about tonight. The teens and young adults. Let me just suffice it to say this, and I will post the links when I post that other stuff. I'm just going to read to you the ages and what little information I know about them. I did not read the entire articles. I just looked for certain cases that I had heard about. Like I knew the age, and I knew, for example, if they played a particular sport, or I knew they lived in Australia or whatever. So these are some of them that I think a lot of people don't think about. Well, first of all, in Kentucky, there was a Jeepers Creepers. In Kentucky, there was a coronavirus party, and now a bunch of people are infected with coronavirus, COVID-19, because they did not do what they were asked to do, which was not to gather. Don't gather in big groups. They were told that. A young gentleman named Jack, 25 years old, healthy lacrosse player. He's in critical condition right now. Heard about him yesterday on the radio. He had to be moved to a different hospital in critical condition, so he's in the ICU on a ventilator. They're hoping, last time I heard, they were going to start him on one of the treatments. But yeah, 25 years old. Tara, 39, she made 2 videos. One was from her ICU bed. One was from her kind of up and around, still in a hospital gown, but 39 years old. There are other cases of 26-year-olds, 34-year-olds, 21-year-olds, 17-year-olds, a 37-year-old British diplomat, a 12-year-old. There was a 3-week-old baby that tested positive with it. This is something, and the reason that I bring this up is young people still are not getting it. I'm just going to write a note for myself to make sure that I publish this. 3-week-old. That's not how you spell week. Oops. All the people that we saw on the beach in Florida, some of them were infected. And guess what? They brought it to wherever they went. Maybe that was home with their parents. Maybe that was to go visit their grandmother for the rest of their spring break. Maybe it was back to their college. Who knows? But we tried to tell them. We all tried to tell them. Everybody tried to tell them. But the beaches stayed open. They were making sure people were social distancing, but come on. What are you gonna do? You gonna stand between 2 people with your arms out straight like a wingspan? No, that's not how it works. All right, so more details about those cases, because I know a lot of people who follow me, you have younger people in your life, or you've asked me, hey, this is what, what was that noise? Sorry. Hey, this is what so-and-so says, that young people can't get infected. Young people can absolutely get infected. And the reason I did not take a break between the 2 parts of that sentence is because if somebody tunes in the middle of a sentence, I don't want them to think I was saying something that I wasn't, or to take it out of context. So I will post those links. They are interesting to read, and they would be good information to share with younger people in your life if they feel like, it's not a big deal. Why do I have to stay in the house? I'm not going to get sick. Let's do, did I bring it in? Let me see what my note was about this for tonight. I didn't bring it in. I'm going to have to do it tomorrow, guys. I'm going to have to do it tomorrow. We're going to move some of the stuff from tonight's live to tomorrow. I will update the description. There's just so much news going on, guys. I want to make sure you guys are informed, but I think it's just going to be smarter to post the links and go over just 1 or 2 facts. But tomorrow we'll do 2 high-touch items of the day. So if you saw the description, OTD of the day. I'm all fancy like that now. So tomorrow we'll do 2 high-touch items of the day. We'll do 2 tips of the day. I kind of put a teaser in there for tonight's. But it will work out, because that tip and what I was going to do tomorrow night anyway is basically a tip. It just shows you how to do the tip. So 2 in 1. We'll do that. The Easter date controversy, I guess I could talk real quick about that. Again, I think it's just different perspectives, like I talked about before. Do I necessarily think it was smart for Trump to say by Easter? No, I don't. But in his position, he has to give hope to us. He has to make it known that there will be an end of the tunnel. And it doesn't matter. I'm not his PR person. I'm not his advisor. But in my opinion, might not have been the best idea. Okay, now I can't find it. But the point is, that's what he's hoping. That's what he wants to have happen. Perhaps the language he used was a little bit more, I don't want to say hopeful. I think it was a little bit more definite than what it should have been. No, he did not say we are definitely doing this, but it almost sounded more sure than I think it should have. But there are other people who kind of chimed in on it. We'll talk a little bit more about it tomorrow, but that's my opinion on it thus far. All right, let's see what else I have here. Biden's cough and Trump's almost handshake. All right, let's talk about this real quick. The crocheted mask, I'm going to wait until tomorrow because that's kind of a bit of a topic. It's something that I saw posted, and I sent the information to 4 of my friends who are nurses and asked them about it. So tomorrow I'll tell you the post and what they thought. And let's see. We'll get to questions tomorrow. I didn't really have that many come in today, but pardon me. Sinus infection. So Biden's cough and Trump's almost handshake. If you're not sure what the heck that means, it was on, excuse me very much. Let me get a drink. My throat hurts. Okay. So they kept showing this video of Biden who was being interviewed probably by satellite or Skype or video or what video call, whatever. And he coughed into his hand like this. And the reporter was like, you're supposed to do this. And, you know, I guess Biden was home alone. I don't know what Biden's response was. It doesn't matter for this discussion, but that's what the cough means. And Trump's almost handshake. Bill Hemmer from Fox News was interviewing him out in some outside part of the White House, and it aired yesterday, I think. And at the end of it, Trump went to reach out his hand to shake Bill Hemmer's hand, and then he caught himself, and he kind of like laughed, and then they did the elbow thing. So why is this important? It's a big deal, and it's important because, first of all, Biden kind of laughed it off from what I did see, but it's important because, first of all, if Joe Biden wants to be the leader of the United States, of the free world, as people call it, wants to be our president, he needs to set a better example, because there's a possibility that we could be dealing with COVID-19 for a long time. I'm not saying we're going to be stuck in our houses for a long time, but what I am saying is this might be something that goes on at some level for a while. It might be something that goes away and comes back. It might go away in 2 weeks, and this is irrelevant. I don't think it will, but who knows? But he needs to set a better example for that, and he needs to take it more seriously, I believe. Let me see what else that I had put for that, and because I don't want to forget the one thing that I did have to say. Yeah, everybody was talking about it. I think if people see somebody else doing it, you know, as it is, we have a lot of people in this country, and don't worry, I'm going to get to Trump's handshake in a minute. Don't worry. You know, I think if people watch him, and I know a lot of younger people in our country support Joe Biden. They were supporting Sanders, and maybe they moved over, or maybe they liked Biden to begin with, or I don't know. I don't know what their case is, but I do know that a lot of younger people do support him, do watch him, are Democrats and interested in him as president. And I just really feel like they might think, especially younger people, well, if he's doing it, I can do it. I mean, they don't know that he might have coughed in his hand, but he's home alone. And maybe he had hand sanitizer right next to him. When the camera shut off, he used it. Or maybe he got up right away and washed his hands. Or maybe he who knows? But people don't know that. All they know is what they see. So that was another reason why I thought that, maybe that's not a great idea. But he didn't seem fazed. He didn't even seem to understand what's the big deal. Like, is there some reason I shouldn't do this? Like, what's the big deal? Now, Trump, on the other hand, he caught himself and kind of laughed about it. You guys have to remember, the handshake has been in human culture for many, 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 many years, like thousands, I would guess. I don't know. Our marketing company, we sent out an article. It's not actually one that I wrote or proofed or edited, but it's been around for a long time. And the reason the handshake came out is so the person that you're meeting can see you're not holding a weapon. If you hold your hand out, I mean, who knows what's in your other hand, but I guess they weren't concerned about that. I think it's like from Roman times, the Roman Empire, and they would shake like this. That's where it comes from. But it's been in our culture for so long, and he's just so used to it. Being in real estate, being who his dad was, being on TV and being president. I mean, that's just what you do. And he is getting better about it. Like I said, he caught himself. They did the elbow thing, and that was great. The reason why it's so important for us, all of us, Biden, Trump, everybody, to be doing these things is because it takes about 2 to 3 weeks for something to become a habit. Unfortunately, we don't really have 2 to 3 weeks. We didn't have 2 to 3 weeks 2 to 3 weeks ago, but we have to do all we can to contain this virus. So that's why it's kind of such a big deal, in my opinion. Got to set good examples. We have to understand that people only see certain things. They don't see anything that happens before or after that if it's on TV, right? They only see what's shown. And even if, this is another thing with TV that I'm sure some of you realize, but some of you might not. When they're shooting a TV show or an interview, the camera goes on long before the interview starts because they have to check sound levels through the microphone and how it looks, and they have to check lighting and all of that stuff. So it could very well have been that Biden came, he sat down, he sanitized his hands. After he coughed in his hand and he was off camera, like I said, he could have sanitized them again. Quite frankly, it looked like he wasn't quite understanding what the big deal was. But the point is, what we need to show people is that we're doing the right things. So even if, you have to sneeze and you do this and your kid's in the room and they walk out and they don't see you wash your hands or sanitize your hands, they might think, oh, mommy did it, it's okay if I do it. So it's very important that we make sure that we're doing what we're supposed to. And I hate to be like this, but all the time. Because younger people are watching, older people are watching, we're watching ourselves, we don't want to get this thing, and, we're trying to build good habits. So if you're not somebody who was washing your hands so much and sanitizing your hands and having good surface hygiene and stuff like that, welcome to being chronically ill. Nice to have you here. Take a seat. This is what it's like, and there are people who are a lot more ill than me and have a lot more immune issues than me. So I think I'm going to wrap it up here, guys. It is 8:40 my time. I've been on for about an hour. Thank you so much for coming in and hanging out. I appreciate everybody's kind comments and questions. I love answering questions. I really do. There are no stupid questions. The only kind of questions I don't like are the ones that are almost rhetorical, where somebody asks a question and then they have a snide comment. Like, no, we don't need that right now, right? We don't need that right now. So please ask any questions that you have. If you have a story that you read and you want me to debunk it, or make sure it's true, or anything like that, let me know. I do put out some consumer alerts, like if I see, a good example, the other day I posted one, maybe it was even yesterday, the days are so long right now, a link from someone's Etsy shop, and they were for face masks, beautiful looking face masks, and they were called dust masks. She put that right in the title, they're called dust masks. I'm assuming it's a she, I'm not sure. And then in the description, it said that they're not antiviral. So this is nothing that the seller did wrong, but it just goes to show right now, everybody has so much on our minds. We're so stressed out. So, just kind of read through things a couple times. Make sure you know what's on offer. Make sure you understand what you're getting, how much it costs, what it's good for, all of that stuff. So guys, I am going to finally sign off. It usually takes me like 10 minutes to actually do so after I say I'm going to. So I will be back tomorrow night. We'll do some of those demonstrations and the high touch thing of the day. We'll do 2 of those. We'll do 2 of the tips, and yeah, I'll see you guys then. Like I said, if you have any questions, if you want to know anything, hit me up, say hi. Tomorrow will be fun. I'll see you guys then. Have a great night, and thank you so much for hanging out. Thanks, YouTube. I will see you guys later, too. I'm going to try to set these up as an actual event, so it's much easier for you to go through and click every day and get a reminder. There's just so much going on right now, and I just started doing the whole YouTube thing, and especially the live thing and all that really regularly, so thanks for hanging in there with me. I really appreciate all of you guys. Again, you're so kind to me. You're so appreciative of what I'm doing, and it's just my little way of doing something that I can to help. So again, comments, questions, I love them. Please let me know what you want to know, and I'll be back tomorrow night. Have a great night, guys. Stay safe. Wash your hands. Clean your surfaces. Sanitize your surfaces. Stay healthy, and I'll see you then.